Hello everyone, Dr. Matt Finke, Doctor of Chiropractic, back with you again today. Today we're going to talk about a specific condition, a very common condition, probably one of the most common conditions we see in our practice, and that is headaches. Now obviously a headache is any type of pain or discomfort surrounding the head, different parts of the head, the entire head. But more specifically I want to talk about that there are many types of headaches and also many causes of headaches. So the most common types that you and I have probably come across, the cluster headaches, the tension headaches, the migraine headaches. There's also the sinus headaches from the pressure. I see a lot of those. And probably the most painful that I've seen is when people describe it feels like they've got an ice pick stabbing the back of their eye or right behind their eye, real sharp. I call it the ice pick headache. So those are the most common headaches I see. Now, the one thing I always tell people is this: headaches are common, but they are not normal. They're common, but they're not normal. It is not normal for you to have pain in your head, pain behind your eye, any type of pain that a headache would be associated with. That is absolutely not normal. It's common, but it's not normal. Now, one of the most common causes or types of headache that is often overlooked is what's called a cervicogenic headache. Now, cervicogenic translates very literally into originating from the neck. So a headache that is triggered by something in the neck is called a cervicogenic headache. It's a very common headache type that I see every single day, and in my experience, it's a very overlooked type of headache. So what does a cervicogenic headache look like? Well, typically, what we'll see in the office is the bones of the spine become twisted or misaligned and stuck out of position. Now, in order for that to cause a headache, two things are generally happening. Number one, the nerves that are coming out here between the skull, the first and the second bone, those nerves are being compressed. And you notice here, this red structure here, this is called the vertebral artery. The vertebral artery supplies 100% of the blood up into the head and the brain. When those vertebral bones become misaligned and stuck, what that does is it blocks, or it compresses, or it occludes, or it actually chokes these nerves and that artery. And that causes less nerve supply and less blood supply to go up into the head and into the brain. And when that happens, that can definitely cause and trigger a headache. A simple way to think about this, here in Cincinnati, last couple of weeks we haven't had any rain. Now we're getting some today, but we haven't had any rain. So a lot of people are watering their lawns. So the hose goes out from the house to a sprinkler. If that hose gets twisted or a kink happens in the hose, what happens to the sprinkler? Yeah, you get less than normal water supply going to the sprinkler. The grass doesn't get water and the grass is eventually going to die. Same thing happens up in the neck with these spinal misalignments. If those bones are misaligned and stuck and they're choking and pinching, compressing the artery and the nerves, there's less blood and nerve supply going up there. That's going to affect the way that the head feels, the brain functions, and that can trigger a headache. Now, unfortunately, the most common treatment today are medications that either reduce pain or reduce inflammation, and in some severe cases actually restrict blood flow up to the head and to the brain. So here's one example of medication prescribed for headaches. This is Imitrex. This is, from what I can tell, is probably the most common medication that is prescribed for migraine sufferers. And you see right at the top, it says, Imitrex is a headache medicine that narrows blood vessels around the brain. Now, right off the bat, that doesn't sound real good. Tells you some other things that can help with migraine symptoms. It's either oral, it can be a spray, or it's an injection. As you keep running down here, as it says, it should not be used for tension headaches or headaches that cause loss of movement on one side of your body. That should bring some concern to you. Here's some important information I want to show you. Should not use Imitrex if you have uncontrolled high blood pressure, heart problems, certain heart rhythm disorders, or a history of heart attack or stroke, or circulation problems that cause a lack of blood supply within the body. Main reason that is because of what direct effect it has on the body. It narrows blood vessels. not just around your brain, but around your whole body. It's narrowing blood vessels. You can also see in this section, it says before taking this medication, all the things linked to heart, circulatory system, poor circulation, coronary artery disease, a heart disorder called Wolff-Parkinson-White syndrome, uncontrolled high blood pressure, circulation problems affecting your legs, arms, stomach, intestine, and kidneys. Why? Because if you're taking a drug to get rid of a migraine, and what that drug does is narrow blood vessels, again, it's happening around the brain, but it's also happening all over your body. It's narrowing blood vessels. It's reducing blood supply, not only to your brain, but to other vital organs, especially your heart, your lungs, your liver. All the vital organs of your body are affected by any medication that is reducing blood supply to your body by causing the blood vessels to constrict. Now, as a chiropractor, what I do is I use my hands. I just use my hands only, and I gently realign the spinal bones. And by realigning the spinal bones with a chiropractic adjustment, what that does is it immediately takes pressure and compression off the vertebral artery, off the nerves going back up into the head, into the brain. If there's pressure off of those structures, you get better nerve supply, better blood supply up to the head and the brain, and guess what happens? The headaches resolve naturally without the use of those dangerous drugs and medications. Chiropractic is a safe, effective, organic, and an easy way to affect headaches because it assists your body's natural healing abilities to take care of the headaches on their own. By just using my hands, realigning these structures, removing that pressure, your body is able to do what it's designed to do, which is to heal itself and to function at a higher level. I've been in practice for 20 years. I've seen headaches that are triggered by, most recently, abnormal posture from people working at home. They're sitting over their computers at a kitchen table, at a laptop, their head's in this position, and that triggers headaches. I've also seen the other side of the spectrum with these severe migraine headaches where people are literally locked in their bedroom, dark room, curled up in fetal position, head covers over their head, taking strong drugs just to get these things calm enough that they can function. So I've seen the whole spectrum of headaches. What I have seen in 20 years of practice is this. If you or someone you know has a headache, it is vital to get your spine checked for these misalignments to see if it is causing any pressure to those nerves or blood supply. The reason it's vital is because literally chiropractic adjustments, removing that pressure, if it's there, can change the way that your life is. Because I have seen firsthand how debilitating these migraines and these headaches can be. So you owe it to yourself. If you have headaches, if someone you love or know has headaches, you owe it to yourself just to find out if this is happening and if it can be corrected naturally, effectively, and safely with chiropractic care. If you have questions, if you have comments about headaches, contact me here. If you know somebody that needs this information, please like it and share it with them. Thank you so much. I appreciate you watching. Have a great day and God bless.